You're listening to the ToeTalks podcast. You've got cancer, but we won't treat it until you start having symptoms. Have you had this sentence stated to you or a loved one in the oncologist office? Or maybe you're an oncologist who's uttered this statement hundreds, maybe even thousands of times in your career. Today, that statement will no longer be valid. There is an option for early treatment no one knows about. And today, we're going to talk about it for the first time. You won't hear it anywhere else. Why? Because this is personal to me. Stay tuned. You're not going to want to miss it. This is big. Real big. We are the rugged, authentic, savvy. And you're in the right place. Live free. Pursue health. Powerful living starts in 3, 2, 1. Welcome to episode 3 of the ToeTalks podcast. I'm your host, Dr. Toe. 2020, the year that sucked. COVID and cancer. All right, I want you to go back in your mind's eye and remember what it was like March of 2020. The madness began. We didn't know it was going to be madness. We slowly, in some aspects, but quickly descended into insanity. Schools shut down. Sports stopped for our children. The isolation and the division began. Fear was the virus. Rational thinking was nowhere to be seen. The unvaccinated were called the problem. And the list goes on and on. In March of 2020, when we first began to hear about this China virus, yes, I did say China with a Y. I was once told that I could not utter that sentence on the college campus or I'd be reprimanded. Talk about censorship. Anyway, I digress. The COVID virus, it was definitely genetically modified, and these jabs for COVID are genetic modification. They are gene therapy. But this virus was definitely in the United States before they started to inform us that it was here. Because in early January, I was at a conference in Florida, and it was an international conference, people from all over the world, to include many countries in Europe. One of them was specifically Italy. And I remember seeing images of people coming from the emergency room because they were so sick. And they actually, the image that I have in my mind is of this person who's in the passenger seat and the person in the driver's seat is taking a picture of them. And they are basically passed out in the front seat with a mask on. That was the first image of COVID, and I'm positive that's what it was. We just didn't know it. I just remember people talking about how bad the flu was this year. Oh dear. Good times, good times. Not really. Today I'd like to go through this timeline in my life that started with COVID 2020. And it sucked for so many different reasons. And I'm sure it sucked for you as well for so many reasons. But I have a purpose in going through this timeline. And I promise you, I will get to it. And I promise you, if you have somebody who has blood cancer in your life, you're going to want to listen very closely. In August of 2020, my husband was diagnosed with chronic lymphocytic leukemia, also known as CLL. It's a blood cancer. The crazy thing about this blood cancer specifically is that when you get diagnosed with it, they will tell you there is no early treatment. there's nothing to do but wait and see. As soon as you start having symptoms, oh, well, then we'll start some treatment, because that's what the research says. It says it doesn't make a difference. I beg to differ. And not once did anyone in the medical field say to me or my husband, hey, you might want to think about making lifestyle changes. And so fortunately, he was married to a healthcare worker, and we began to make lifestyle changes, increasing exercise and major change in diet, as well as supplementation. I don't know if you've ever read this book. It's called Chris Beat Cancer. Highly, highly recommend it. I think it's excellent. He also has a YouTube channel. Very worthwhile if you are dealing with any kind of cancer. And his story is pretty daggone amazing. He beat stage 4 cancer, I think it was colon cancer, by purely changing his diet, which, plays into my thought that a bunch of cancer, maybe not all, but maybe the majority, is a metabolic issue. And our gut is our immunity. Highly recommend that book if you haven't gotten it and you have somebody in your life or you yourself are struggling with a diagnosis of cancer. Which, by the way, if you've taken any of these COVID jabs, you are at risk of turbo cancer. That's another story for another time, but you must protect yourself. And I would encourage you to go to FLCCC. Make sure you type it in correctly or else you'll go somewhere else. And it has a lot of research based on the COVID jabs and the COVID injured, how to fight off the virus in general. It started early on in the scandemic that this organization was put together. Lots of reputable, incredible physicians. And then there is also the wellness company that was started by Peter McCullough, Dr. Peter McCullough. If you don't know who he is, you need to look him up too. Him and Dr. Corey, Pierre Corey, and Paul Merrick, they're my heroes. I can't say enough good things about them. They saved my husband in so many ways because of the information that they put out, and they were persecuted for it and censored, and their careers destroyed. Sound familiar? Yeah. If you're in healthcare, it's probably you and me. Anyway, if you go to the wellness company, I think it's wellnesscompany.com. They have a supplement there with a bunch of things in it, but the main one is nanokinase. It's an enzyme, incredibly helpful in helping people who are COVID jabbed, injured. It's called Spike Supplement. Go check it out. All right, so let's get back into this timeline. So August 2020, he was diagnosed with CLL. And then in spring of 2021, so we're fast forwarding here, we were in the thick of fighting off mask mandates at school with my son. I was going to school board meetings for all the other madness that was going on at that time. In our state, it was transgender bathroom privileges, books that were garbage with porn in them, and so on and so on. So I was at these school board meetings speaking out, which didn't help my children in general because our family was the troublemaker, and they suffered because of it, which is sad. Adults should act like adults, but they don't. A lot of them don't have a moral fabric. They need Jesus, all I gotta say. Anyway, that progressed into the fall of 2021, which was probably one of the hardest seasons of my life. My kids were being homeschooled. We said, no, we're tired of being jerked around by the really bad school system that we had. We were tired of the poor online learning. Didn't want our kids to be at risk of being in a transgender bathroom where my son would be accused of doing something inappropriate to a girl who was saying she was a guy, or a guy walking into my daughter's bathroom and doing something horrible to her, which did happen in, I believe it was Loudoun County, Virginia, twice by a transgender male who sodomized and raped 2 girls at 2 different schools. This individual finally went to jail, but there are other school officials that should be in jail and aren't. Okay, so let's get back into it. It's so many rabbit trails or tangents I could go off on. I'm sure you can relate. As the fall progressed, September came upon us. I had lost my job, my teaching job at the college. My husband's CLL symptoms were worsening because of the swollen lymph nodes in his neck. His neck was 2 to 3 times the size it normally was. And the oncologist was saying we probably need to start chemotherapy treatment. Early in September, my daughter was the first person to get COVID in our family. And miraculously, none of us got it after she got it. Yeah, contagious? Not as contagious as the flu. I can guarantee you that much. And she didn't quarantine herself to the room like some people would have made their children do. No, I treated her exactly as I normally would with any kind of virus. And she got over it. It was extremely mild for her. By the end of September, however, the bottom dropped out. My son, my husband, who is immune compromised because of his CLL, and I all got COVID at the same time. Caden and I were pretty bad off. We all had the Delta virus variant, but my husband worst of all. And unfortunately, at this point in time, I did not know how to defend ourselves against viruses in general, or how to help my husband, who is immune compromised, get over something like this. It was definitely a trial by fire, unfortunately. By October 12th of 2021, he was kidnapped by the hospital. Yes, and I do mean that in every sense of the term. I call it the Hospital Ovens story because they tried to kill him. And again, this is not hyperbole. He actually got worse because of their treatment in the hospital. He had pulmonary emoli in his lungs, mainly because they didn't give him a high enough dose of blood thinner. It was just a horrific time because obviously I was armchair quarterbacking it from my phone as he was in the hospital. Now, there's a reason why I'm telling you this story. When he was in the hospital, there's a silver lining to everything, right? Ashes to beauty. He was pumped full of so much steroids, oral and inhaled steroids, that it put his CLL symptoms into remission of some sort. It slowed the progression of symptoms. His lymph nodes had shrunk to normal size by the time he was out of the hospital. He was in the hospital for 18 days. By the time he escaped from the hospital ovens, he didn't need chemotherapy. He managed to avoid needing treatment for CLL for 9 months. However, by May 2020, I knew his symptoms were progressing again and that he was headed for treatment. So I began to pray and research other options. I really didn't want him to have to go through chemotherapy. By mid-June, my husband started treatment against my will. He was on an oral chemotherapy drug. This is what they give people for CLL. And they tell people that they're going to be on this drug for life. Can you imagine this? You're going to be on a chemotherapy drug for life. I said, no way. This is not going to happen. We are not staying on this thing for life. And it lit a fire underneath me. I knew that chemo was not the answer. Now, if you don't know this, you need to listen in really carefully. Chemotherapy does not, I repeat, does not kill stem cells in cancer. And if you don't kill the stem cells, the cancer is coming back. So basically, chemotherapy is a delay of progression of the disease itself. And here's the kicker. Chemotherapy itself has a high risk of causing other cancers. The cure to cancer is also the cause of other cancers. It's maddening. But in my deep research, I came across 2 drugs, both of them that work synergistically alongside chemotherapy treatment. One of these drugs is FDA approved. The other is not. It's only approved in animals. However, the other drug is currently being studied in humans. These 2 drugs are in a class of anti-parasitic drugs. One of them you know very well if you've been paying attention. It's ivermectin. The data shows that ivermectin specifically has the ability to target and kill cancerous stem cells. The other drug that is not FDA approved for humans is fenbendazole. But both of these drugs target cancerous cells, leaving normal and healthy cells alone. This is something that chemotherapy drugs do not do. Unfortunately, chemotherapy kills healthy cells. However, fenbendazole and ivermectin are very selective. They leave the healthy cells alone. The research also validates both positive effects on the immune system and the bone marrow of animals affected by lymphomas when treated with fenbendazole. Specifically, this drug may have a high selectivity in killing leukemia cells at low doses, making it far less toxic than using chemotherapy drugs or agents that have a high likelihood of not killing the cancer, but delaying its progression and causing other cancers. Furthermore, the use of fenbendazole in conjunction with vitamin supplementation specifically inhibited cancerous growth in mice. So after I saw just what these two drugs in research were doing, both in humans and in animals, I said, you know what? We're going to try it, because the safety index for ivermectin, I know you've heard me say this, is extremely good. It is actually better than Advil or Tylenol. More people have died from Advil and Tylenol than ivermectin combined. So what did I do with this research? I began to apply it to my husband's health while he was taking the chemotherapy drug Brukinsa. And you know what? Within a month, it began to work. My husband had monthly appointments with the oncologist. After he had been on it for a month and he went back to the oncologist and they always did blood work, the oncologist came into the room and said to him, and I quote, "Wow, look at you. What are you doing?" End quote. Yeah. His blood work had significantly changed regarding his chemotherapy treatment and how his blood work was supposed to be reacting to it. Now, some of you might be asking, did the oncologist know that he was taking these two drugs? No. Why? Because she was closed-minded and we did not want to compromise his treatment. So we didn't tell her. And she still doesn't know. And that is another story for another time. So my husband continued to take these two drugs alongside his chemotherapy drug for several months until around December, they started to wean him off of it because his immune system was his white blood cell count was getting too low. Now, this is the thing that they don't tell you about this drug. They say, oh, you're going to be on it for life. Well, the truth is most people aren't on it for life because they have to be taken off of it for one of three reasons. One, their immune system goes so low that it's dangerous to keep them on it because it would continue to kill off their immune system. Or two, the side effects of the drug are so bad they become life-threatening in some way and they have to come off the drug. And then they're put on a different drug. Or three, they relapse, meaning the drug stops working. And again, they have to be put on another drug. So 7 months after he started taking these two drugs alongside his chemotherapy, he was off the chemotherapy drug and he stayed off of it. Now, they were waiting for his blood levels to come back into a good range. He went back to the oncologist, and the oncologist, without a beat, was saying, okay, we're going to restart the Brukinsa. And of course, my husband says, well, do we have to? Can I stay off of it? And she said, sure. Now, if my husband had never said anything to her, he would still be on it. I just don't understand this at all. Every single medical healthcare professional should always tell you the options of what you can do and the pluses and minuses or benefits, risks that go along with those decisions. It's not their decision. And the sad thing is, I really believe a lot of this is money driven. The big pharma companies give them kickbacks directly to the doctors, or the hospital that they're working for, it gets kickbacks, and therefore the hospital puts pressure on the physicians. This is bad medicine and medical malpractice in my mind. It's not the way you should be practicing medicine. By April 2023, I had written the ebook, Kicking the Viral Load. And if you haven't picked up a copy of that and you want one for free, go to www.drtoe.com and pick it up there. Then in January of 2023, I decided to write a case report on my husband. What is a case report? Basically, when a healthcare professional sees something unique in the field, either treatment, response, a new treatment, something that is unique that they feel is probably worth somebody doing further research on. And so that's what I decided to do with my husband, because I said, you know what? I think this actually helped him. But I needed to know for myself that what we did for him was actually beneficial. I couldn't just say, hey, look at this. This is something that you should try. Or maybe, people should do more research on this. I had to have some support, some evidence, some data that said that it actually was beneficial for him. Guess what I found? Did this protocol help him? It's a resounding yes. Yes, it did. Yes, it did. Currently, there is no early treatment for CLL. No more is what I have to say to you. This protocol that my husband was on is safer and maybe even more effective than chemotherapy. Certainly makes chemotherapy more effective if you have to have it. And I tell you, if I had known about this in 2020, August of 2020, when he was diagnosed, we would have started trying this right away. Because in my mind's eye, I'm like, I wonder if we had started these two drugs on him, it might have saved him from having to do chemotherapy. What would have the effect been on his body then when there were no symptoms? The reason why I wrote this case report is to hopefully help somebody else out there, because I know there are lots of other people who are struggling with this and people who are just getting newly diagnosed with it. For a physician to say to them, oh, we're just going to wait and see. And once you start having symptoms, we'll start treating. No, you fight. The second you know that you've got something. Never in the history of the world have we ever said, we're just going to wait until it gets bad. So it's my hope that this information gets out to people to help them, that they have the opportunity to try an early treatment, whereas we did not. And if you are in the midst of starting chemotherapy, about to start chemotherapy, have been in chemotherapy, this protocol may be an option for you. And I say may for a very good reason. Because I am not a medical doctor. I am not your medical doctor. I hold a doctorate degree in physical therapy. And one of these drugs is not FDA approved. I want to make that very clear. Fenbendazole has not been approved for human use. However, it's been used in animals for decades, and research for that matter for decades. And there is animal research for treating cancer. But this is what I can tell you, that I am a healthcare professional with a very scientific mind who has put together a case report with evidence showing this protocol was beneficial. That's what I can say and what I can tell you. What I can also tell you with certainty is this, that this case report is novel in that the subject, my husband, who was diagnosed with CLL, was able to achieve progression-free symptom status and was able to fully stop and remain off the oral chemotherapy drug Brukinsa for almost 2 years. This January 2025, it will be 2 years that he has not needed chemotherapy. This occurrence is extremely novel. I did not find this outcome anywhere in the research. Only 58% of CLL patients successfully remain on Brukinsa for approximately 24 months without experiencing toxicity, concerns, or relapse. However, only 80% of the 58% will achieve progression-free symptom status within 18 to 24 months while taking this drug. While taking the chemotherapy drug, they will successfully achieve progression-free symptom status. These patients will then eventually be taken off Brukinsa due to drug toxicity or disease relapse, meaning the drug stops working. And this will happen by 34 months. So therefore, the patients will only enjoy, while they're taking the chemotherapy drug, this progression-free symptom status for approximately a year to 18 months. And my husband has been enjoying over 2 years of progression-free symptom status without the chemotherapy drug while remaining on these 2 anti-parasitic drugs. You might be asking yourself, so what, Dr. Toe? So what? How does this help me any? This is what I'm excited about. I decided to put together a CLL early treatment protocol that came out of this case report so that other people could see what we had done and decide what they want to do with that information. I'm excited to tell you, you can go to www.drtoe.com and purchase this protocol guide. And it is my greatest hope that it will bring hope to people. It will bring help to people, and researchers will begin to give this subject matter the time it deserves in the clinical research setting. But my greatest goal in getting this information out is to bring health and healing to people. I don't know what it's going to do for you. I know what it did for my husband. And so I'm going to be faithful to what the Lord has asked me to do, what he has tasked me to do. And that is to be faithful in bringing this information to the world. Thank you so much for listening to this ToeTalks podcast. If you like what you heard and you want to hear more, please subscribe. And if you're new here, welcome. I'm so glad you are along on this journey with me. We have each other. We are not alone. Next time on the ToeTalks podcast, the birth of early treatment CLL protocol, offensive protocol, and case report. I hope you'll tune in. Live free, pursue health, and breathe deep. Until next time, everyone, this is Dr. Toe, signing off. Important disclaimer. This podcast is presented solely for educational and entertainment purposes. I am not a medical doctor, and I do not diagnose, advise, or treat. This podcast is not intended for the substitute of advice from a personal physician, professional coach, psychotherapist, or other qualified professional. It is not intended to be used or relied upon for any diagnostic or treatment purposes, or to be used as a substitute for professional diagnosis, treatment, or conventional medical therapy. None of the statements made in this podcast have been evaluated by the Food and Drug Administration. Please consult your healthcare provider before making any healthcare decisions or for guidance about specific medical conditions. Listen responsibly.